COVID-19 cases and deaths have been rising in the past few weeks, with vaccination rates plateauing.
Here in Germany, the slowing pace of inoculations has forced authorities to find creative ways to get things back on track.
It's in our hands. It depends what we do where this pandemic goes.
It's the most urgent public health challenge of our time. The COVID-19 pandemic has killed nearly 5 million people around the world. Vaccines can slash mortality rates, but only when people have their jobs. And that's not always a given. Some governments don't give people a choice. Others try to nudge citizens by restricting where the unvaccinated can go. Some have even offered bribes. But what if I told you that there's a country that didn't do anything like that, and yet has one of the highest vaccination rates in the world? When you take countries with more than 10 million people, Spain is the only one where nearly 80% of people are fully vaccinated. As of October 7th, Italy only is at 69%, France at 67%, and Germany at 65%. So how did they do it? And what can others learn from the Spanish success story? As we'll see, some reasons are specifically Spanish, but others might work in other places. For Spain, the factors we're going to look at created the perfect storm together.
Realmente 100%, tengo 100%, 200% confianza en la sanidad pública española. Creo que tenemos un sistema increíble.
That confidence, that trust, is one of the cornerstones of Spain's successful vaccine drive.
There has been always a close relationship of the population with their family physicians, with their health centers, and this reflected in the dynamic of vaccination.
And in Spain, it's all free, and has been for decades. Universal healthcare is even enshrined in the Constitution.
Trust is absolutely not something that's normally sort of delivered via text message or from a single infomercial. It's built up over time from seeing that systems are working for people, that they're generating good outcomes.
This confidence in the health system translates to trust in the vaccines it offers. A study by the Imperial College London found that 79% of Spanish people trusted COVID-19 vaccines, compared to 62% in the US and 56% in France. Another factor that pushed people to trust the vaccines was the devastating first wave of the pandemic and the way Spain got out of it. That first wave killed nearly 50,000 people. Most of them were elderly.
And almost everyone has a relative or a friend or someone that know that experience this kind of problem or died in the hospital, in the corridor of the hospital, or even before going to the hospital. And this is in the mind of everyone. So I believe that no one wants to have a similar experience during this year.
Many of those who died had been infected by younger relatives. Spain is a country of close family ties, and different generations often live together. More than half of Spaniards in their late 20s live with their parents or grandparents. When older people got vaccinated, hospitalization and death rates dropped dramatically.
And the success experience in the nursing homes, in the geriatric places, was incredible. Incredible. To me, as an infectious disease doctor, the results were better than expected.
People saw vaccines working, and the fact that so many saw elderly relatives die meant they knew it was at stake.
Para mi familia, que oye, son personas ya un poco mayores, tienen 60 años y bueno, es cuidar un poco de ellos y poder tener la garantía de ir a casa, volver y no contagiarles, o por lo menos que no sea tan fuerte.
Y este tipo de valores más colectivos estamos viendo que está siendo muy importante a la hora de decidir vacunarse y está formando parte de la estrategia de vacunación, de comunicación de la vacuna en España, ¿no?
The authorities made protecting older people part of their messaging to Spanish teenagers. Nearly 90% are vaccinated. For German teens, the figure is only at 35%.
There have been very targeted campaigns to the youngsters for promoting the vaccine. TV spots, advertisement organized by the Ministry of Health, engaging youngsters in telling other youngsters that it's important to be vaccinated.
Science suggests that when I see that most people, particularly people who identify with, if I see that a lot of them are doing something, it changes attitudes, because then I start to think, oh, well, maybe they know something I missed, and I sort of don't want to be left out either.
But it wasn't just the message which played a role in getting young people jabbed. Authorities helped by making it easy to do.
People are often dissuaded when they hear about hassle factors or aren't absolutely sure this is recommended for them. And so research shows that if, for instance, you give people an appointment and simply say, you know, we've scheduled you at this time and date in a convenient location, that can dramatically increase vaccine uptake.
There were personalized phone calls to call for the vaccination, follow up by the family physicians in the primary healthcare centers. There is now an active search for the rest of the people to try to ensure that those who were not able to be vaccinated because they were traveling or they were sick or they have had COVID recently are identified, are reached by the system, and we complete the vaccination.
Another factor that helped Spain's jab rate was the low level of anti-vaccine sentiment.
I think all in all, there was very little receptivity or tolerance to the discourse of conspiracy or anti-vaccine.
Spain's newspapers and television stations also played a role. Critical and science-based discussion is vital to build trust, experts say.
In all the media, there was a constant scrutiny of how well we were progressing with the vaccine. And it was not just general information, but quite the granular analysis of how we were advancing with each population group in each region, how the vaccine was being distributed and whether or not it was being applied.
And that region-by-region analysis led to a race between traditional rivals.
Catalonia and Madrid, for example, they compete. And they compete not just in soccer, in football. They compete in many different things, political issues, and once the government buy and supply the vaccines to every autonomous community, everyone wanted to be the first to vaccinate more people.
And that brings us to the issue of access. Spain was part of the EU Common Purchasing System, so getting hold of the vaccines was never a major issue. But for other countries, it was and remains a huge problem. Many smaller and poorer countries were stuck at the back of the line for vaccine contracts. Africa is the continent with the lowest rate of vaccination. Sierra Leone, Nigeria, and Cameroon have fully vaccinated less than 1% of their population. The factors we've mentioned don't matter if there's no vaccine available. But Spain was lucky and did sensible things in that lucky situation.
So it's a happy alignment of planets or combination of factors. Trust of the population, reliability on the health system by the population and on the population by the health system. Good responsiveness to the calls for vaccination and a real concerted effort of prioritizing the vaccination.
Of all the factors we've considered, experts say trust is one of the most important. And it will be trust that makes all the difference the next time a killer virus strikes.
I don't know of a quick switch we can flip in societies where trust is lower to make it higher, but I do think this points to the hard work we need to do in the years and decades ahead, because this is not going to be our last pandemic or our last crisis where trust in science matters. And I think we need to invest more in building that trust and making sure it's earned.